Eden Medical Center helps people living with mental illness on a daily basis through medication and therapy. They've had many successful outcomes, but sometimes those methods aren't enough.
I was working at a very stressful job and decided that the best avenue would be for me to retire. And after I retired, I seemed to drop off a cliff and went down a deep hole and was having anxiety and depression. I was having recurring, like a constant tape running in my head of suicidal thoughts. I attempted to act on those thoughts, was unsuccessful, and it just kept playing. I did seek help, and my primary referred me to a psychiatrist, and then I eventually ended up at Eden and in their partial hospitalization program. And I actually went through that program twice.
Michelle was at the point where something had to change, but was she ready for what doctors would prescribe next?
I was back in here. Electroconvulsive therapy was suggested. And of course, my first thought was the cuckoo's nest and what that would do and what I would look like flopping around on a table. But, I said, no, I'm really not interested in that. I thought I could do it by myself and do it with the medications that I was on. And that didn't work. And the tape kept playing. And I said, well, I think I'm at a point that I need to try it. What have I got to lose? A few hours in the operating room, that's it. And so I agreed for electroconvulsive therapy, which basically hooks up electrodes to specific points in your body to a machine that delivers electrical current to your brain. And it reorients your brain and works on the chemicals there and helps to reorient you.
Michelle was brave enough to overlook the stigma associated with ECT and found a treatment that worked for her.
I survived. I wasn't One Flew Over the Cuckoo's Nest. I wasn't Frankenstein, all of those horror pictures that you conjure up in your mind. But it was a very orderly procedure. You're given under general anesthesia, so you are asleep. You are given a paralytic agent, so you're not flopping around. And then the electrical current is delivered. And you wake up, and I have had no side effects.
Dr. Boris Zakowski, a psychiatrist at Eden Medical Center, has a practical answer when addressing concerns about the side effects of ECT.
Somebody who was depressed and who is no longer depressed, I believe, benefiting from ECT, from electric shock. When you take aspirin or Tylenol, you take a risk of side effects too, but the majority of us don't have any side effects. So the same thing with ECT.
And for Michelle, the reward greatly outweighed the risk.
I've tried all of these. Here's an avenue I haven't tried. What's the worst that can happen? What people worry about is memory loss. Okay, if I forget your name, we got a problem. If I forget all of these feelings I've had, that would be a blessing.
Electroconvulsive therapy, or ECT, has been around for a long time, but it's not the way it is in the movies anymore. What is it like?
So ECT is a treatment indicated when people are not responding to the medications or they're feeling suicidal, or also in bipolar mania. A complete medical workup is done, which includes a neurological workup and a cardiological workup. And then with an anesthesiologist, they're under anesthesia when ECT procedure is done. So it's completely safe to go through that procedure. And it augments the treatment. It boosts the treatment response to the existing antidepressant medications.
And it's a series of treatments. It's a series of
treatment that is instituted based on the needs of the patient.
Okay. And there was something else that Michelle was talking about that she started out in before she got this other therapy, and it was called the partial hospitalization program. What is that?
Partial program is a unique program. It's based on group and cognitive behavior therapy. And when they're seeing a psychiatrist, the group-based therapy also provides help and support to the patients who also undergoing significant depression in their lives. And the psychiatrist also follows up with them in terms of changing medications and providing them with individual therapy.
So it's sort of an intensive, but it's a day treatment. You don't actually stay in psychiatric services, stay in the hospital.
So you come in the morning at 9 a.m. and then most of the patients leave by 2 p.m. and the lunch is provided.
And how long do you do that for, those consecutive?
So based on the individual needs of the patient, it could be provided to a patient. They would come in 3 days a week, or they would come in 5 days a week.
Okay, some sort of unique intensive therapy if you need it at the time in a condensed manner. Fantastic. So stay with us. When we come back, we'll tell you how you can find out more about all of the things we talked about today on Your Health Matters. Depression, anxiety, panic, and bipolar disorders are just a few examples of the illnesses treated at Eden Medical Center's psychiatric unit. Now, I have to ask you, as we're going into the holidays, one piece of advice that you would give to anybody to help their mental health.
And get help, get support, because there's treatment available.
And it works pretty fast, it seems.
It does work fast.
All right, absolutely. Thank you so much for joining us. To find out more about any of the subjects we have covered today, visit online at edenmedcenter.org or call the number on your screen. That's 1-888-445-8433. Again, 1-888-445-8433. And such good advice today. Thank you for joining us, and thank you for tuning in, because your health matters. Take just the next 2 minutes to discover how to help yourself or someone you love tackle anxiety, panic attacks, or depression. I'm Peggy Pico. Mental health is just as important as your physical health, yet there are no mental health gyms to help you get your mood in shape and keep it that way. But Eden Medical Center's Psychiatric Partial Hospitalization Program is changing all that. Dr. Akbar Gilani from Eden Medical Center is here to explain how this program works.
So patients come in Monday through Friday, and they come in at 9 a.m. in the morning and they leave at 2 p.m. So they get group cognitive behavior therapy while participating in the program, and the psychiatrist also provides medication management during the stay there.
So it's sort of an intensive day treatment sort of therapy.
It is more intensive than outpatient treatment, yes.
Okay, it sounds like a good option. There's something else that is being used by former First Lady Rosalind Carter and gaining popularity. It's called ECT. How does that work, and how is it different from what we've seen in the past?
ECT is a treatment of choice sometimes when patients' depression is not responding to the medications, or they have recurrent suicidal ideations. Often also in manic condition, ECT could be instituted. So there is a full neurological and a cardiovascular evaluation is done, and after medical clearance, they would, under anesthesia, the psychiatrist would provide them with ECT treatments.
And ECT stands for?
Electroconvulsive treatment.